Hi, I'm Stephanie Carzone-Abrams. I'm a neuropharmacologist, and today I'm going to be diving into a recent study that's causing a lot of ruckus. Psychedelics are no more effective than antidepressants. And honestly, that's a headline that's a masterclass in misleading precision because at first glance, it really does sound definitive. Case closed, forget psychedelics. But if you pause and you glance again, you'll notice three sleights of hand. One, no more effective does not mean not effective. This is the most important distortion here. If psychedelics perform equally to antidepressants, that's not failure. That's parity with a multi-billion-dollar first-line treatment class used globally. And what's even more curious to me is when I remember that SSRIs not only show response rate around 60% at best, and many patients discontinue due to side effects. So, no more effective could easily read as psychedelics match existing treatments with radically different mechanisms, but that headline wouldn't generate the same friction. Number two, it collapses psychedelics into a single thing. The headline treats psychedelics as if they are one uniform intervention, but the data here is drawing from psilocybin, ketamine, MDMA in the broader literature, different doses and different therapeutic frameworks. So, this is like saying surgery is no more effective than medication without specifying the type of surgery or the condition the surgery is for, or whether it's elective or emergent. It's not so much wrong as it is without context and true meaning. Three, it ignores how the outcomes are measured. So, the comparison here is hinging on depression rating scales, but those scales are capturing symptom reduction and not transformation or meaning or behavioral change, relational repair, existential resolution, and so much more. What about spiritual insight, narrative reframing, and identity changes? Psychedelic therapies operate in those domains by design. So we've got a headline here comparing a pharmacological therapy built for symptom management with a pharmacological therapy built for psychological reorganization. We're actually supposed to pair with psychotherapy, right? And we're using a ruler that only measures symptoms. Now, the study, it was a meta-analysis, and that is going to matter. The study analyzed control groups across trials. It found that control groups in psychedelic trials improved less than control groups in antidepressant trials. And from this, it inferred that psychedelic effects might be overestimated. That's a few steps removed from psychedelics don't work as well. So they didn't measure psychedelic outcomes versus antidepressant outcomes directly. They measured control group behavior across different types of trials. And that's going to introduce massive variability. Different populations, different expectations, different trial environments, and different control. Meta-analyses are powerful and they're really important, but they're only as clean as the data that they aggregate. And here the data is anything but uniform. Now, to address the double-blind critique, yes, psychedelic trials struggle with blinding. Participants can often tell if they've received a high-dose psychedelic versus a placebo. This is called functional unblinding. But here's something that you should know. This isn't a flaw unique to psychedelics. Many psychiatric interventions have expectancy effects. SSRIs, therapy, and even the placebo itself. And in psychedelic therapy, the subjective experience is part of the treatment. So trying to fully blind a psychedelic study is like trying to blind a study of music by asking the participants not to notice the sound. The experience is not noise, it's the signal. So meta-analyses can flatten reality. They average across protocols, therapists, set and setting, and patient readiness. But psychedelic therapy is hyper-contextual. Its effectiveness is really going to depend on preparation, environment, therapeutic alliance, and integration. And they're not side variables here. They really are the treatment. And so I wanted to break down a little bit, about what psychedelics do that antidepressants don't. And this is where the comparison is truly going to break down because psychedelics are not just biochemical interventions, they're experiential catalysts. We have rapid effects with psychedelics, more rapid than SSRIs, which can require weeks to months. Effects with psychedelic therapies can last months after a single treatment, whereas SSRIs are going to require daily dosing. Psychedelics are going to promote heightened neuroplasticity and a reopening of learning windows, which is important in the therapeutic process. It's not just about symptom suppression, it's about rewiring and relearning. And then there's emotional processing. By reducing amygdala reactivity with psychedelics, we're supporting the trauma processing. Whereas SSRIs can often blunt emotion, psychedelics are going to amplify and help resolve. We've got meaning making and narrative repair. Patients have reported reprocessing trauma, reconnecting with purpose, reframing identity, and all of this isn't easily measured using a PHQ-9 or a GAD-7 or a HAM-D score. Psychedelics are often studied in people who have already failed antidepressants, and this is important because it actually makes equal effectiveness even more notable here. End-of-life care is also something important to mention. Psychedelics are going to help reduce depression and anxiety and help with acceptance and meaning in cancer patients, in terminally ill patients, or people who are receiving palliative care. And oftentimes antidepressants have failed. Holistic outcomes. Some researchers describe psychedelic therapy as a more holistic approach to mental health, a more integrative approach altogether, because it's not just about symptom reduction, it's about a life reorientation. So the deeper issue here, I think, is what counts as efficacy. I think we're asking the wrong question. Not are psychedelics more effective than antidepressants, but effective at what? If the goal is to reduce depressive symptoms, then great. SSRIs are performing reasonably, I guess. If the goal is to transform relationship to self, process trauma, restore meaning, and shift your behavioral patterns, then we're in an entirely different category, new territory. So is this a category error? I think that the headline is comparing a maintenance medication model with a catalytic experience-driven therapy, and it's asking which one is better. So the real takeaway here is that, yes, okay, the study raises valid points. Blinding is a challenge, expectancy effects matter, and early psychedelic trials may be overestimating effects. But the headline, it compresses nuance into a verdict that the data simply do not support. And a more honest version might read something like, psychedelic therapy shows comparable symptom reduction to antidepressants, but methodological challenges and fundamentally different mechanisms complicate direct comparison. And so I know that that's less clickable, but I think it's infinitely more true. And I'd be happy to hear your thoughts. So thanks for listening, and feel free to comment below and engage in dialogue.